Hi everyone. Hi. Please write hi in comments if you can hear me clearly. Hi. So today we are going to talk about something which is everyone in this life is going through, that is aging. But before we start the Instagram live, I want to introduce you about Colors. Colors is a healthcare organization which was founded in 2004. Um, and today we have 50 plus branches throughout the India with 60 plus dermats working, and we are expertise in slimming as well as cosmetic and aesthetic dermatology. So our topic for Instagram live today is anti-aging. Can I get a little bit of thumbs ups in the comments if you people can hear me clearly? Okay, I'm getting a lot of waves. Great. So, starting with the aging, and little bit, I want to first of all tell you all about how our face changes with age. So, three type of changes happen. First is what are visible changes that happens due to collagen and elastin loss in our skin, which are the main molecules that makes our skin firm and supple. And with the loss of collagen and elastin, which starts happening around mid 20, we start seeing visible changes like fine lines. There'll be very fine wrinkles, which one appreciate mainly around the under eye area, because that is the area our skin is the thinnest, and that is where we start experiencing early signs of aging. Then comes the pigmentation change, which is very commonly seen in Indian population. Our skin type is from anywhere from skin type 2 to 5, so we are very prone to tanning and pigmentation changes. And these pigmentation changes due to aging can be just as simple as excessive tanning, or it can be uneven pigmentation like melasma. It can be freckles, or in some people they can also develop with time certain TPNs or skin tags, which also make the skin look very uneven. And along with that, there'll be an overall dullness due to loss of collagen and elastin, which helps in supporting our skin and make it firm and again supple. Then comes the volume loss or the fat pad loss in our skin, which leads to deep folds. And that also we start experiencing first around our eyes, then our laugh lines, and then there'll be loss in volume around our temples. So this is how the aging happens. And I want to tell you that in between this live, if you have any questions, you can type in the comment. I'll be taking a lot of questions, but I'm giving you a journal overview about aging first. So just to summarize it, there are three main ways where how we experience aging. One is your journal skin changes due to collagen and elastin loss, which is fine lines, dullness, rough texture, open pores, and loss of glow that we see in younger people. And then it and then it's pigmentary changes, which are mainly due to sun damage, or it could be due to hormonal changes, or it could be due to inflammation in your body. And those are seen as, it can be excessive tanning, or it can be melasma, it can be freckles. Then comes your volume loss, which can be due to the fat pad loss, and later in ages it's also due to bone resorption, so your skin will start to sag. And a young face is always in the form of an inverted triangle, but with age, that inverted triangle, all the volume that you have in your mid face and on your upper face starts to sag, and you'll start noticing the formation of jowl, deep nasolabial folds, which are also called as your laugh lines, or folds around the eyes. Then with age, your muscles, your facial muscles also tend to be overactive, and you'll start experiencing dynamic line formation, which first of all it starts with your frown lines or the 11s with and then there'll be your horizontal lines on your forehead. It will be your crow's feet around the eyes, and these are the areas which your muscles like your procerus or your corrugator muscles or these frontalis muscle will start becoming overactive in your late 20s, in your early 30s, and this is when the dynamic line starts to form. So accordingly, depending on how you're aging and what is the thing that bothers you the most, our treatment plan is focused on every individual, taking in a detailed analysis of everyone's face and what is the primarily aging happening, if it's in form of pigmentation or if it's in the form of volume loss, or what is it. Sometimes some people are okay with the volume loss happening in their face, but they are not okay with the pigmentation changes. And I personally also always recommend to my patients and the patients we receive at Kolors to first work on pigmentation, because when you have a very even face, that in itself is a great achievement. Okay, so someone has asked, does laser help in anti-aging? Actually, lasers have very important role when it comes to anti-aging, and we have three main type of lasers. One is fractional CO2 or a fractional erbium laser, through which we achieve a beautiful resurfacing of face, and this is something I believe everyone in their 30s and 40s once in a while should go for resurfacing through with the help of a fractional CO2. It helps with open pores. It's very preventative when it comes to changes like fine lines and wrinkles. So, and then comes your PDL lasers or your IPL lasers that works on your redness, or it works on the pigmentation abnormalities. So different concern, different laser, but I think fractional laser or fractional or resurfacing using fractional laser is something everyone should consider starting in their 30s, or it can be done even in the 20s. And these are very safe treatments. Does include little bit of downtime from anywhere from 5 to 7 days, but the results are very promising, and there will be a lot of collagen boosting that happens with the help of laser resurfacing that we do. It can be done for face, it can be done for neck, and with the help of eye shield we can even do it around the eyes. And people really like the results of laser resurfacing when it's done for fine lines, crepiness. It helps in really tightening all the open pores that we experience with age, and it's also gives you a nice glow because of the new collagen production that happens, and it helps in evening out the skin tone as well. So any other question you people have on laser resurfacing? Or okay, there's one more question, how to improve skin elasticity with age. So this is very important because our skin, as I discussed, with the loss of collagen that starts happening in your late 20s, after 25, every year we start losing 1% of collagen. Then how do we improve it? As first is to have a really good skincare going. Sunscreen is compulsory. There is no excuse for not using sunscreen. Then another would be using very good molecules that are time tested when it comes to anti-aging. One would be retinol, which is every dermat's favorite. Every dermat's working in Kolors really like putting our patients on retinol serums, and nowadays we have new age molecules which are peptides. I personally really like copper peptide based serum. So starting your base when it comes to preventing skin elasticity loss is a good skincare, which should include sunscreen, and it can include either retinol serum or a peptide serum. In the morning you can add some antioxidant serum like a vitamin C serum. Then a very basic treatment to start would be microneedling. Better if you combine it with PRP, but just basic microneedling gives leads to so much elastin and collagen production, which really helps in firming the skin. It also helps in improving the lost skin elasticity. And then also again laser based treatments are there that I talked about. Fractional laser also helpful in skin elasticity. That is in your early 20s and 30s. With age, like if someone comes to me at the age of 40 and want me to work on their skin elasticity, then I would go for a little bit more advanced treatments, injectables. Like we have biostimulators like PTRN or hyaluronic acid skin boosters, which when we inject also leads to a lot of collagen production, which ultimately helps in improving skin elasticity. Someone has asked what is the best anti-aging for their age, and 31-year-old female living in Bangalore. So for a 31-year-old, I'll give you a basic skincare plan. In the morning, face wash, use an antioxidant serum, vitamin C. But if it doesn't suit you, there are some people, vitamin C doesn't suit everyone. If it doesn't suit you, then you go for either niacinamide or you can go for a hyaluronic acid serum, and use a good sunscreen, minimum SPF 50. Then at night is when you actually work on your skin, and you should use either a retinol. Start using retinol either two times, maximum 3 times a week, or you can add peptide based serum. Look for peptides like arginine and copper peptide. These are the good molecules to begin with. And nowadays we also have exosome serums and PTRN serums that one can try, but retinol and peptides are time tested. They are the OGs when it comes to anti-aging. And using a good moisturizer. Moisturizer is very underrated when it comes to anti-aging, but a good hydrated moisturized skin is very, very important, and it goes long way. So use a ceramide based moisturizer at night. If you do this much, you're sorted. Are peels helpful in anti-aging? So one of the very commonly done treatment at aesthetic clinic is chemical peels. Chemical peels are little stronger active molecules. Like if you get a 10% of an active molecule in your skincare, in chemical peels we use 20, 30 up to 50 to 70% concentration of that same active. Now chemical peels are a great basic level treatment to start when it comes to anti-aging. They mainly focus on exfoliating your skin. So we have variety of chemical peels which work on exfoliating and removing the dead cells from your skin, removing the top pigmentation as well. So it's very good when it comes to uneven skin tone, the dullness you have, or it's great for even tanning. To remove tanning, peels are very useful. So peels do have a place in anti-aging, but they are mainly focused on dealing with pigmentation, uneven skin tone and tanning. We cannot target volume loss with peels, because as they are topical solutions, they work at they are absorbed up till a certain depth in your skin. So again, they are mainly focused on treating pigmentation, sun damage that we see, even helpful little bit with the freckles and the melasma. Again, melasma, we have very a wide variety of chemical peels which can be which are really helpful in treating melasma. Someone has asked, is aging skin reversible? So, when start at the right time, aging is definitely, we can prevent it, and premature aging can be reversed up to a certain degree with right skincare, right kind of treatments, and also with right kind of lifestyle and diet habits. But if you come to us at 30s 40s, not taking care of your skin for 10-15 years, they cannot fully reverse all the aging or the signs of aging in your skin, but it can be managed and can definitely be controlled. So the goal, anyways, the goal always is to make you look best for your age, and the rest is up to you to maintain that with the help of good skincare. And another very big factor would be to control sun exposure, and just basic, again, I'm saying it again and again, just using a good sunscreen with minimum 50 SPF would be a great thing for your skin. How long do anti-aging procedures last? Someone has asked this. So depending on different type of procedures, there different type of procedures, the results last for a different time. There are some one-time procedures, like we do Botox, which is a very commonly done anti-aging procedure. The results last for good 4 to 6 months and can be repeated after every 4 to 6 months. For fillers, depending again on what kind of fillers have been put up, the results last for minimum 6 months. It can last for up to an year as well, and then it can be repeated again. Then the results of getting lasers done, the whatever result that you achieve with lasers or the collagen remodeling or the collagen stimulating treatments are usually the results that are achieved are almost permanent. But again, you are going to experience more aging, so we need to repeat them again. So again, it depends on what kind of anti-aging treatment or procedure that you're getting. Can anti-aging treatments remove pigmentation and spots? Yes, actually, pigmentation is one thing that can be tackled very well when it comes to anti-aging. We have a lot of modalities that work on pigmentation. I have already discussed about chemical peels. Another very good modality is a Q switch laser, or now we have even advanced version which is called as pico laser, which targets your melanin, the pigment, and it breaks it down, and that is a really good modality to work on pigmentation and age spots. It works on sunspots, it works on freckles. So and we see pigmentation is one of the most common concern that we see in our clinics. Almost every day we have many clients coming with pigmentation, and we do treatments for them, and many of them get very good results. Again, at home you have to take care about the sun exposure and use a good sunscreen and use good actives to maintain the results that we have given you with our treatments. So, how long does it take to see results from anti-aging treatments? I'll talk about some commonly done treatments. There are some treatments wherein the results you can appreciate it on the table as soon as we done it. One of them is fillers. We put in it's a hyaluronic acid based injections. We put it in your skin. Mainly it's done to improve the sagging of the skin. So if we put it in your around the mid face, or if we do it for jawline reconstruction, so you can appreciate the results on table. and the maximum results are achieved within 2 weeks, 10 to 14 days. Then comes the another most commonly done anti-aging treatment is Botox. The results take about 3 to 7 days for Botox to start showing results. Then when it comes to treatments like collagen stimulating treatments, which are your skin boosters or your biostimulators like PDRN treatments and the Sculptra and all of these treatment, it takes about 4 to 6 weeks for the new collagen to form, for the new collagen assist to happen. And when it comes to lasers or microneedling and fractional CO2, there is some downtime involved of about 7 days, and again the results take about 4 to 6 weeks. Someone has asked what are the best treatments for stretch marks. So when it comes to stretch marks, first we need to understand why stretch marks happen. Most of the time when someone has suddenly gained a lot of weight in a very short span of period, the skin stretches, and the supporting the tissue work, that is your collagen and elastin, is not enough to support that skin, so the skin looks very thin, and that is your stretch marks. So again, the best treatment would be something to tighten that skin with the help of new collagen and elastin production. So fractional CO2 would be a great treatment, or you can go for microneedling with radio frequency along with PRP injections, and all of this combined, either CO2 with PRP or microneedling with PRP, will help in regenerating more collagen to make the skin and the stretch marks look to minimize their appearance. So one of the very common misconception and apprehension that people or patients have when it comes to anti-aging treatment is they feel that once if we start doing it, we have to continue doing it. So that is actually not true. Every anti-aging treatment has its own lifespan. If we have done Botox for you, the results are going to last 4 to 6 months, and then you will go back to your normal state. It's not like your body gets dependent on anti-aging treatments. They do not get dependent on Botox, they do not get dependent on fillers or skin boosters. You can choose to stop doing these treatments, or you can choose to go for them again and get repeated sessions done. It's entirely up to you. And we also don't believe in that every little correction, every little aging sign, like every fine line or every wrinkle, every fold should be corrected. The aim is to make you look natural, to make you look best for your age. So if you have come to us in your 40s and you want to look best, our focus would be to give you an a very even skin tone with no pigmentation, while correcting your deep wrinkles and fine lines. So someone has just asked how to treat deep wrinkles and fine lines. So the only treatment that works when it comes to fine lines and deep wrinkles is Botox. Many a times people ask ki, if I don't want to go for Botox, is there any cream available that can be used? But there is no cream, no topical massage or gua sha which can replace Botox treatment. That is something that works on your muscle activity. So the toxin I am discussing about Botox treatment. I will also take up this question is when can we start doing Botox. So first of all, the most common indication for Botox is these 11 lines the horizontal lines that we see, and the crow's feet that start appearing around your eyes. So we put in injection, it relaxes those muscles, prevent them from contracting, which forms those dynamic wrinkles. And you can start as early as in your late 20s. That is when most of the people start experiencing it. But we believe in not completely freezing the muscle activity. We believe in giving you very natural looks that doesn't make you look frozen or overdone. How to improve skin elasticity with age, I have already discussed about it, but again I will give you in short, I'll explain that we have treatments like microneedling, fractional CO2 and skin boosters, which works on improving the collagen and giving you a more firmer, supple looking skin. Botox is not used to change our face shape, it's only used to control the dynamic wrinkles. What I mean by dynamic wrinkles is the wrinkles or the fine lines that comes with the facial expressions. So if I'm raising my eyebrows, you can see I have these horizontal lines formed. If I get Botox injection in my forehead, this muscle will relax and these lines will disappear. If I frown, then you can see there are some lines forming for me. And if I get Botox done here, these muscles will relax and I will not have these wrinkles forming. So this is the main science behind getting Botox done. The result starts to show after 3 to 7 days, and it lasts for good minimum 3 to 4 months it lasts, and one can repeat it after every 6 months. Another commonly done anti-aging treatment is filler. Filler is something that we use that is used to restore the volume loss that happens with age. These fillers are hyaluronic acid made injectables in which hyaluronic acid is cross-linked, and that is injected wherever you have volume loss. So one of the very common indication of doing fillers is the under eye hollowness or the under eye tear trough deformity that we start experiencing. And we put in hyaluronic acid fillers, and the filler absorbs water and it makes your skin, it restores the volume and it makes your skin look very supple, shiny and glowy. Someone has asked, is skin booster of any use? So skin booster is actually one of my very favorite anti-aging treatment that I like doing for my patients who do not want to change anything in their facial features but still want to work on their skin quality. Profilo is one of the very good skin boosters that we have. Another good are skin weave, and these are the treatments that we do. We inject them in the deeper layer of your skin. These are again hyaluronic acid molecules. They stimulate collagen production, they hold on to the water, and the skin quality is improved, the suppleness, and they also, the shine that they provide to your face also helps in masking the pigmentation. Again, very good treatment when it comes to dry, sensitive, even eczema prone skin. So if someone has very dry, sensitive skin, I always recommend them to get skin boosters done. There have been patients of mine who are like, after getting skin boosters, I do not even need to use a moisturizer. My skin has become so good, and patients are actually really happy after getting skin boosters. I think it's one of the great innovation when it comes to anti-aging treatments. The results last, and again with skin booster also, the whatever facial contouring that we are trying to achieve, the results are achieved on table with the maximum results, with the maximum water absorption. All happens at around 2 weeks, and the new collagen formation happens at around 4 to 6 weeks, and the results last for good 6 to 8 months, and one can repeat one can get them repeated after 6 months. At what age can we start anti-aging procedures? So anti-aging procedures can be started at as early as in your mid 20s. Like I discussed, after 25 your every with every year 1% of your collagen is lost. We can start with very basic treatments like microneedling and some laser treatments. Usually around 30 is the time when people start consider getting Botox done, and fillers can be done at any time after you're 20, depending on what your concern is. If there is anything that you want to, some people have like thinner lips, so they want to go for lip fillers and all. There is no age bar for that. We can start them after 20. But if someone wants to take care of the jowls, that starts happening after your mid 30s. So depending on what your concern is, then at that point we can consider different type of anti-aging procedures. So it's a big umbrella. There are a lot of procedures included which can be done at different age for different people having different type of skin concerns and different anti-aging concerns. Any good moisturizer recommendation for oily acne prone skin? This is one of the very common question, and I think it's very important. As I discussed, moisturizer is a very underrated thing when it comes to anti-aging. A moisturized skin, and not just your face but the whole body. You should always moisturize your body as well when you take a bath, because a moisturized skin goes a long way. Ceramide based moisturizers are great, and there are many options available with good oil controlling properties as well. Can anti-aging treatments tighten loose skin? Very good question. Yes, there are many anti-aging treatments that work on tightening skin. If you are loose skin, you mean open pores, then we can do fractional lasers and resurfacing. We can even work with microneedling, radio frequency. These are the two very good treatments that work on tightening your open pores. But if you're talking about loose skin, like loose body skin, if there is someone has lost a lot of weight and they have loose skins, so we have skin boosters like Body Profilo, which are injected in those loose skins, and they really help in again, a lot of collagen remodeling happens, and the tightening results are achieved with those treatments. Even microneedling, radio frequency can be done on different parts of the body, and radio frequency based treatments are there. Then there are ultrasound based treatments. So different modalities are there to tackle loose skin, which works on constricting your collagen and making more collagen and improving the skin quality, improving the texture to give you a tighter and more firmer skin. So definitely loose skin is one of the biggest concern people have when it comes to anti-aging, and we have different modalities that can be worked with. Again and again people are asking about what age can we start anti-aging procedure. I think around 30 and late in your 20s to early 30s is a good window to visit us, and we can make a good plan for you to with all treatments that you should go for to prevent. This is the time we can actually prevent premature aging, and we can always guide you about lifestyle habits, diets, and everything. The whole plan can be made which will be tailor made for every individual on the treatments and skincare to start on. So late 20s and early 30 would be a good window to start considering anti-aging procedures. Another thing that is not being asked, but it is a very important concern that I see commonly in the clinic is the sagging that happens and this jowl formation and the deep laugh lines or deep nasolabial folds. These are the concerns that most commonly start bothering people in their 30s or in your 40s. So the treatment that we do for them, which gives very good results, is face lifting threads. We put cork threads in the face, which gives you instant lift. So they instantly lift your face and the results last for good 6 months. This is one treatment that comes very close to giving you non-surgical facelifting kind of results. And again, if we do not want to go for something injectable based or invasive, we also have machine based modalities like ultrasound based HIFU is there, which helps in decreasing the fat and the heaviness of your lower face, and it also helps in tightening the collagen and giving you that supple, lifted and firm look. And someone has asked about skin booster, how many times boosters are required and what is the gap between each skin booster. So there are different type of skin booster. One of the really good one and one we do commonly is Profilo skin booster. 2 sessions are done with a gap of 4 weeks, and the results last for good 6 to 8 months, and even up to an year. So one can repeat it at least after 6 months, or even after it can be stretched up to an year. So another skin boosters are there, like Restylane skin boosters are there, Skin Weave skin boosters are there. Those need to be repeated after 6 months. Their results is good up to 6 months. How long does the fillers last? So fillers are little bit more concentrated hyaluronic acid injectables when it comes if we compare to skin boosters. Again, depending on what kind of filler has been put up, if it is just for if it was for volume loss or if it was for reconstruction, the kind of material used. But on an average, fillers results last good for 6 to 8 months. One of the very common question that people ask before getting filler treatment is, everyone is scared of that overdone and puffy faces and overfilled looks that we see in social media or those celebrity faces. So one thing I would want to clarify is, if done in the right way, fillers can give you very good results. And fillers usually completely get metabolized in 6 to 8 months, so the results go away. And that overfilled faces or those puffy faces that you see, those are results of repeated injections and too much fillers being put in short span of time. So one doesn't need to be scared. If your injector is smart, if you have gone to a good injector and a good dermatologist, they know how to get you the right result with very subtle and changes that do not make you, nobody would want that. The best kind of work would be, the best filler job would be that nobody can tell that you have gotten done anything on your face, but still your face looks better. Your folds are gone, your jowls are gone, you have nice contoured younger looking face without anybody noticing it, that there has been any drastic change. So that is always our aim. And also people are very apprehensive when it comes to injectables. So fillers is something which is very painless treatment, because the injection, the syringe, it has hyaluronic acid filler and it comes with local anesthesia which is mixed with the filler. So when we start injecting, there is almost instant numbing that happens of that area. So it's almost very painless treatment and a very comfortable treatment to get. Which treatment is better for skin tightening? Again, depend on which area of skin tightening, but machine based modalities, I like fractional CO2 or fractional erbium laser, and microneedling with radio frequency. Also radio frequency, ultrasound based HIFU for skin tightening. These are the three treatments I like which are machine based. Then when it comes to injectables for skin tightening, collagen stimulating treatments, again like Profilo or biostimulators like Sculptra are great for when it comes to skin tightening. Are anti-aging treatments painful? Uh, Depend again on what type of treatment, but usually the if I have to tell it on a scale of 1 to 10, the pain level, it also depends on person to person what your pain threshold is, but usually all the treatments that are done are quite comfortable. If any treatment is painful, then we make sure that a numbing cream is applied and appropriate anesthesia is given to make the procedure comfortable for the patient. So like when it comes to CO2 laser, we always apply a topical anesthesia cream for 40 to 45 minutes before doing the treatment, to make it comfortable for patients. Whereas when it comes to fillers, it comes with the local anesthesia and it provides instant numbing, so we do not need to give any anesthesia. And for Botox as well, people find it a little uncomfortable, so we make sure that we apply anesthesia cream. Overall, anti-aging treatments are quite comfortable, and they are not something, pain is not a very big issue that patients face. It's quite comfortable to get them. I would also like to take some time to talk about what all lifestyle changes one needs to make when it comes to anti-aging. One of the two very common culprits when it comes to anti-aging is smoking and sugar. So smoking really is really bad for your skin. It cuts off the skin blood supply to your skin, and even if someone smokes and we are doing a lot of good anti-aging treatments, the desired result might not be achieved. So avoid smoking and avoid sugary diets. When I say sugary diets, I not only just mean desserts, but I also mean to cut down on your simple carbs. So decreasing white breads, again, rice, or having a balanced meal which has enough fiber, enough protein, with the right amount of complex carbs. And again, adding strength training is very good when it comes to anti-aging, because it is scientifically proven that weightlifting and strength training uh, leads to a very good collagen production, and that is one of the uh, key foundation when it comes to your anti-aging journey, is to have a very good diet, lifestyle, and exercise schedule going on. So there is no compromising on that, because if you want to achieve the maximum of the anti-aging treatments, it's very important that you follow all of these things, with also right amount of antioxidant rich diet, which can include colorful vegetables, colorful fruits, something like pomegranate, kiwi, vitamin C rich fruits, and all of these things. If you include in diet, then you have a very holistic approach when it comes to anti-aging, or aging right for your age, and avoiding premature aging. If there is any other question regarding any of the treatments that we have discussed, I think we have not touched a lot about pigmentation treatments. Pigmentation is very common concern when it comes to with age, the uneven skin tone. A lot of people experience freckles and tanning, and even acanthosis is a very stubborn pigmentation of face and neck, and the folds of your skin, like the private parts and the underarms, starts to get dark, which is directly linked to insulin resistance, and in women it's linked with PCOS, obesity. So again, a good lifestyle with active, at least minimum 1 hour of walking, to strength training or yoga or pilates, any exercise schedule, with having a balanced diet is very important. Then there are many treatments that we do at clinic for fighting the pigmentation, starting from chemical peels, then to skin boosters, also certain lasers. We have Q-switch lasers, we have pico lasers, which gives amazing results when it comes to pigmentation. um, so that is something that we commonly do day in and day out for our patients. We have last 10 minutes of this Instagram live, so before wrapping up, if there are any concerns, questions that you people have, please ask. Some people are still joining. Many of the time, patients are apprehensive about safety profile of the treatment, so I want to touch that, and side effects when it comes. That is the most common questions that patients ask. So most of the treatments are quite safe, and we would not recommend anything that comes with a side effect that cannot be dealt with. So if you get treatments done under a dermat's guidance, under your the right injector, uh, they the side effects are almost taken care of. Just the laser treatments come with certain downtime of 3 to 7 days, and almost all other treatments do not have any major side effects. If at all some undesired, sometimes patients change their mind and they do not like the results, then fillers is one treatment that cannot that can be completely dissolved, and it's completely reversible as well. But in our practice we rarely had to do that, like and anyways, we make sure that before going for any treatment we have explained in detail about the treatments. We make sure that we take a detailed history of our patients before going for any treatment. So all of this is done with proper SOPs in place, and so that increases the safety profile of the treatment. So we have last 5 minutes of the Instagram live left. If any questions regarding any of the treatments that we have discussed, please ask in the comment section. Are home remedies effective for anti-aging? I think more than home remedies, what I told you is having a good lifestyle, an active lifestyle with healthy diet, and avoiding smoking and alcohol. If you get these three things right, you're sorted. There's no other home remedy that needs to be done. So, all right, everyone. I think we will wind up for today. And before we close, I want to remind that aging is not just about fine lines and wrinkles. It happens at three levels. It impacts your skin quality, the pigmentation, and the volume loss. And if we understand the structure, the anti-aging becomes logical instead of confusing. So starting early with the right sunscreen and good collagen preserving treatments and habits, one can really look best for their age, and you can even look 5 to 7 up to 10 years younger. I have seen the changes of the skin of people who have been diligent, who have been regular with their anti-aging treatment and their skincare and having a good diet and lifestyle. There is a huge difference in someone who doesn't take care of it. When we, like, maybe in 20s you do not appreciate it, in 30s you do not appreciate it, but you will definitely appreciate in someone who's in their 40s and 50s and 60s. You can definitely tell the impact of aging in someone who has not taken proper care, proper treatments from someone who has taken it. So again, anti-aging is not it's not about looking artificial or looking frozen. If you go to the right injector, you go to the right doctor, it's just about looking a fresher, well rested version of yourself. And if you found this live informative, do share it with your friends and family. Do visit us at Kolors Healthcare for your treatments, for consultations, to get on to the right plan. And if it we still have few minutes. If at all any query, you can type in the comments. I'm still here to take a few last comments or few last queries. Someone has asked, I need advice for young wrinkles in the forehead. I don't know what does young wrinkles mean. I mean, I assume they are meaning like at younger age when they start experiencing wrinkles in their forehead. So if they are just fine lines, we can take care of them with fractional CO2 or microneedling with radio frequency. But if you have dynamic wrinkles, then Botox is a great treatment to go for. Any other question? We are about to wind up in 2-3 minutes. Also, we do this Instagram live every once in a month, so do let us know if there is any other topic that you want us to talk about in our next live sessions. We are open for your feedback, and if you want if there is any other suggestion, any other query, make sure you put it in the comment section. We are always looking for feedback. So I think we are going to wind this up for today. Okay, thank you so much, people. It was a very interactive section. And I hope you got some valuable information out of this live section. Again, if you want us to talk about any other topic or any other skin or hair concern, we do this Instagram live every once a month. Do let us know in the comment section what would you like us to talk about for the next time. Okay, thank you so much for your time.